Students in the OSCE exam overthink and look for a rare diagnosis. My professor used to tell me, common diagnosis, you are commonly right. If you're thinking about a rare diagnosis, you're rarely right. This is part of my ABCDE approach. This is a video from my OSCE mastery system. So, A stands for action words, B stands for blunders, C stands for common diagnosis. If you think about common diagnosis when you're reading the scenario, you are commonly right, like my professor said. Think about common things that will cause this symptom. In my previous videos, you would have heard that what will kill this patient or the blunder is a common thing you need to ask for any symptom. But the next thing I asked is, what are the common causes that will cause this symptom in this patient? Let's take a 5-year-old child with a throat pain. You would ask yourself, first, what will kill this patient? That's the blunder. Then you ask, what are the common causes of this throat pain in this 5-year-old child? If you think in a structural or a systematic manner, you will not miss anything. You will be a safe doctor and you will be a successful clinician. I wish you all the best. If you would like to know more about my OSCE mastery coaching system, or if you would like to pass your clinical exams in the first attempt, or if you would like to be a confident clinician, look for a link under this video or in the bio, and I will see you in that training video where I teach the whole OSCE mastery system and also the 5 pillars to be a successful clinician.